All right, we're gonna wait for some people to come in, and we will start in just a moment. Okay, so I guess we're going to go ahead and start. My name is Vabren Watts. I am the Director of Health Equity at Health Affairs, and today I am joined by Patti Sweet, our Director of Digital Strategy. And today we will talk about disability health and accessibility in health services research, and how we came to this month, October, where we published our issue on disability and health. Today, if you would start the slide, please. Today, we will cover, for those of you who are not as familiar with health affairs, a brief introduction of health affairs, an overview of the disability and health issue, prepping for the issue, accessibility audit and roadmap by Patti Sweet, the Accessibility and Inclusion Committee, outreach, and lessons learned from this issue. Next slide, please. Next slide. So Health Affairs is the leading journal of health policy, thought, and research. It was established in 1981, and it sits under the auspice of Project Hope, a nonprofit international health education organization. At our core, we are nonpartisan. We are policy focused. Next slide, please. A multidisciplinary journal with topical breadth. And that those list of topics include, next slide, a list of dedicated topics that also includes themed issues, such as our themed issues a series in 2020, such as the Affordable Care Act turns 10, as well as climate change in 2021, borders, immigrants, and health, as well as perinatal mental health. And this year in 2022, racism and health. And we continue with our current issue. Next slide, please. Disability and health. Just to let you know, just to give you background, usually our themed issues start about 12 months before it is published. In the latter part of 2021, we received funding for our disability and health issue, as you see, from the Robert Wood Johnson Foundation, the Ford Foundation, as well as the John D. and Catherine MacArthur Foundation. We wanted to highlight the disability and health because disability affects nearly 1 in 4 adults in the United States. The landmark 1990s Americans with Disability Act created a legal definition of disability and defined important protection for folks in this community. Yet, people with disabilities experience persistent health disparities for reasons including longstanding discrimination by the healthcare system, as well as the broader social and economic sectors. Aware of this, we at Health Affairs proposed a series of content and activities designed to shine a spotlight on the topic of disability and health with the goal of improving access to care, participation in the healthcare system, and ultimately health outcomes. So on October 3rd, 2022, we did launch our themed issue. Our expert advisors for this themed issue was Lisa Izoni at Harvard Medical School, as well as Javier Robles at Rutgers University. And this issue actually started, we actually kicked it off with a virtual symposium, which I'll go into next. Next slide, please. Let me see this. Okay. This is out of order. I'm just going to keep talking. So for the disability and health issue, the top disability and health articles to date did include, there was an array of topics that did include I'm Not the Doctor for You, physicians' attitudes about caring for people with disabilities, Standing Up for My Sister, which is a Narrative Matters, have almost 50 years of disability civil rights laws achieved equitable care, patient and coworker mistreatment of physicians with disability, and harmonizing disability to improve disability research and policy. We also engage with our with our audience via different formats. This includes our podcast series, A Health Policy, a podcast in which our editor-in-chief, Alan Weil, speaks to researchers about published manuscripts. For this issue, Alan did speak with Lisa Meeks, creator and host of Docs with Disabilities, on ableism and treatment of physicians and disabilities. We also have our This Week podcast. Each week, our trusted editors, sometimes with help from special guests and thought leaders, discuss this week's most pressing health policy news. We also had events, which included the Health Affairs briefing, which opened up our disability issue. We also had Journal Club and Lunch and Learn. We also had written content other than the flagship journal from our forefront article, our platform that provides readers with the latest high value and health policy news and commentary. We also had healthcare equity requires standardized disability data in health electronic records, and disability and health in 10 exhibits themes from the piece from Health Affairs, as well as a piece on art enables, which I will discuss later. Next slide, please. Okay, I'm going to go back to the slide before. It seems like some slides we're missing. So one more. The slides are got out of which. Okay, so when we look at the quote from one of our authors, Monica Mitra, it says, from a social model perspective, disability occurs when a person with an impairment interacts with physical or social environments that do not take the full range of human body variation into consideration in our unaccommodating or as hostile as a result. So in this definition of disability, which there are several definitions, the social model definition, it basically says that disability is a social construct, and disabled people are an oppressed minority with unique stories and perspectives. Next slide, please. Knowing this, we really wanted to ensure inclusion within this issue. Our issues first started out with a planning meeting. During this planning meeting, we did ask our planning committee members about any accommodations that is required to increase accessibility. We also, in our meeting, included closed captions as well as a ASL interpreter. And then we also provided opportunities for run-through sessions in order to be more inclusive. We also wanted to take a look at our procedures. In this case, we could not do business as usual. We did outreach to journals focused on disability and health. This includes journals that are part of the Gallaudet publishing press, as well as the journal actually entitled Disability and Health, to see how they receive abstract submissions. After receiving insight from them, we did incorporate some of the procedures that they did in order to be more inclusive. And then one of the another big thing that we did was actually extend the time for requests for abstracts. Usually at Health Affairs, our requests for abstracts are about 3 weeks in duration in that time period. And so what we did for this issue, we actually extended it by 1 week. And then we also did a pre-announcement that was an additional 2 weeks prior, before the request for abstract was released. So we're looking at a total of 6 weeks that people were aware about this upcoming issue. Since then, we're sort of are actually modeling this for other themed issues. Is similar to the curb cutting effect, which the curb cutting effect did come about in the disability equity world, whereas curbs were cut so that people in wheelchairs can have more access to the from like sidewalk to sidewalk. In this case, for the curb cutting, once you cut the curb, there were it did allow for other people, that, for instance, women with strollers, people who are moving things by wheel, to become more accessible. So once you actually advance equity for one particular group, you actually advance equity for all. And this is why equity is important. Next slide, please. For some reason, these slides have gotten out of order. So I'm just going to repeat some of the top disability articles. This is our cover. Our top article was "I'm Not a Doctor for You, Physicians' Attitudes About Caring for People with Disabilities," as well as "Have Almost 50 Years of Disability Civil Rights Laws Achieved Equitable Care," and "Harmonizing Disability Data to Improve Disability Research and Policy." Next slide, please. Next slide, please. This slide does talk about engagement. Once again, where I did talk about the podcast, the events, and written content. Next slide, please. Next slide, please. So now we will turn it over to Patti Sweet with our accessibility audit and roadmap. Again, we said we wanted to ensure inclusion, and so we had to take it a step further. So this is where the digital team comes in with the disability and health issue. Patti?
Yeah, thanks, Babe, and thanks for the setup. So what I'm going to talk through is the approach that we took to trying to make all of our digital properties more accessible, in addition to some of the practices that Babe talked about, with having a longer lead time for a request for abstracts, making sure we include more inclusive language throughout. And then I'm going to speak specifically through what we've done with our digital properties to change what we were doing more at the core. Next slide, please. Okay, so before we get into some of the issues, what we did is we actually completed an audit with two of our partners. One is an external agency that did a full accessibility audit to help us hit our requirements in terms of global accessibility requirements. And from that came a laundry list of things that we needed to do to our site. Separate to that, we had our website vendor actually do a VPAT audit. A VPAT is a voluntary product accessibility template, and it's a document that explains how information and communication technology products such as our website meet or conform to the revised 508 standards for IT accessibility. So with both of these, what we're trying to do is make sure that humans, but also the tech that reads our site is able to read it in a way that can communicate it to someone that might not be able to see or hear. So from that, we had a list of things that we need to fix on our website. Full disclosure, these are not all fixed on our website because it is a scholarly publishing website. So we're not able to change things as quickly as one might with a consumer site, but these are some of the things that we've looked at. So one update might be something that you make to the code of the website or the actual core of the website. So an example of that might be the way that we're tagging our content on our site. Another element on here, so links must have discernible text, or we need to actually define the guidelines for sourcing appropriate imagery to align with our inclusive goals and representation goals. These are things that required us to then implement an internal process update. So after we got these audits done, we did input tickets, which is a way that you make kind of tech changes to your website, but we also had internal meetings to figure out how we can implement some of these changes. We did mark these from critical to serious. Again, Babe has mentioned that these slides are a little bit out of order. So this is just an example of some of the serious items that we were looking at. So links must have discernible text. Often, if you look at a website, first of all, if it says click here, I'm not going to click on it because it sounds spammy, and people also tap sometimes instead of click. But regardless of that, from a UX point of view, it doesn't actually tell you what's happening with that link. So it's important to tell the user what is happening. So some of the calls to action or things that we tell users on our site to do might be read more or subscribe or share. Having more discernible text will actually tell the user and the user and the tech, if something's crawling the site, or you're telling tech how to interpret your site, what you're actually going to share and what you're going to subscribe to or what you're going to read more about. So it's making sure that that copy is actually in that text. Additionally, please hold for just one. Okay, sorry. We've all been through a pandemic, just have a little interruption by a child. But so part of this is also implemented. So yeah, so having the text that actually tells the user what is happening is important, because then the screen reader is able to say, read this material, share this material, instead of just read or share, as an example. Social media is another place where we needed to focus. I'm not sure if you've looked at the likes of Instagram. We actually don't have an Instagram account yet. We're hoping to launch that later this year, at the beginning of next year. But you might notice there's more inclusive language at the bottom of a post. So people actually say what's happening in the image. Images, and the challenge with images from an accessibility point of view is you actually need to tell the user and the screen reader what is being shown in the image. And then that is something that is able to be shared with the person that's trying to access the website. So we implemented things from critical to serious to what we're going to kind of try to work on in the long run. And we have made some gains. So we do have better naming of images. We do have better kind of use of these calls to action across the site. And we do have better structuring. And so it's even things like making sure that you can use our website just using a keyboard instead of a mouse. And it's been a considerable undertaking, but we've made a lot of strides, including, as Babe mentioned, having ASL translation for this presentation, which I was just told that I was speaking too fast for one to catch up. So I'm trying to slow down. Happens when I start talking about tech stuff. But all of this is about, as Babe mentioned, making our content more inclusive. Let's see what happens on the next slide. Okay, yeah, this is another one that's quite important. So in addition to the changes that we're making this year, prior to launch of this issue, we did a full redesign of our site with accessibility at the core. So if you look at this site right now, what you notice, and this was our old landing page, there's a lot of color. If you kind of squint your eyes a little bit and try to look at the page, you'll notice that you can't actually tell the hierarchy of content. What's the most important content on the page? What do I want to click on or not? And how do I click on it? And there's a lot of color. So it was very difficult for users to navigate. Also, if you look at the top navigation and the content that we have available there, a lot of our great content was hidden behind multiple tiers of what we would call the site architecture, where we put the information on site. So very color heavy. The text is quite small, and there is a use of red here. As best practice, it's not great to use red text for a couple of reasons. One, it's really difficult to read that contrast with the gray behind. But also, there have been studies that show that using red text, like if you're going to mark up a document and you use red, it kind of communicates anger. So you don't want to use red for that reason either. But hopefully, if we can check on the next slide, it should show you what our redesigned website looks like. Sarah's just gonna pull up that. Yeah, so Sarah, if you go to slide 21, yep, if you start at 21, yeah, perfect from there. Great. And so this is what the new site looks like. So again, if you kind of like squint your eyes some, you can see that it's not so colorful, and where your eye is drawn to is the featured image, which that was actually artwork that we had done alongside this issue. We worked with an organization called Art Enables, and they work with people living with disabilities to express themselves via art, but also to create an entire portfolio. So we did purchase a series of artwork. So if you see any of our communications around this issue, you will see some gorgeous artwork. I will also say there's a podcast that talks about that partnership with them, and talks through in a forefront article where we talk to people that work at that organization. But on this site, you'll also notice at the top, we've stripped away a lot of color throughout. So color should be used more as a call to action and to help signpost, instead of something that's kind of a bit too busy. The blue and yellow are the two colors that we use for call to actions, with blue being a primary call to action and the yellow being a secondary call to action in some instances. And we kind of test at different points throughout. Here it does just say subscribe and renew at the top, because we have a limited amount of space. But if you actually were to interact with some of those pages on the site, you will see that those call to actions are more direct. So subscribe for individuals, subscribe for institutions. And then we have stripped back the color kind of everywhere else so that it's easier to navigate the content. This was done intentionally, not just to make it look better. And it's there for a user to be able to navigate the experience a bit better, but also, again, for those screen readers to be able to find the content easier, and for users to not get overwhelmed when they come to our website. And on the next slide, as I mentioned before, we do have updated social media accessibility guidelines. These have been circulated and implemented throughout everything that we're doing. And we are hoping to launch Instagram. Why is that important for accessibility? Well, part of our general plan for improving the way that we disseminate content at Health Affairs, because I often say you have to be trained to read a peer-reviewed journal article, and that's not very inclusive. But we're going to try to launch on Instagram because it's a platform where we can reach more users, and it's a little less formal, where we can still disseminate a lot of really important information. We are already on Facebook, LinkedIn, and Twitter, and we've had some success there, but we're really looking forward to Instagram of visually telling stories in a way that we haven't done before. So on the next slide, just some additional considerations or what we're working on in the future. So kind of questions about how we're going to do this is we are looking at including audio version of journal articles or forefront articles. This is kind of a big undertaking for us because there are not any fantastic out-of-the-box transcription services that turn written copy into audio that isn't a robot or sounds like a robot. So we might end up prioritizing some versus others, but it is something that we aspire to do. And then really making sure that we include regular visual representation of people living with disabilities. there's a whole movement around stock photography in general, and how it doesn't have enough representation in terms of like race and ethnicity, but also around disability. And so we make a very considered effort to include that imagery in all of our communications. I did just want to make sure if anybody's interested, we didn't kind of go through more of the critical issues, moderate and minor, but the approach that we take is having a roadmap, and here's all of the things that we're going to address from a technical and communications point of view and even process. And then we work through it and we keep revisiting. The guidelines will constantly be changing, as with anything that is digital. And so it's something that we are making sure to review quarterly and annually, and redoing those audits as and when we need to make sure that our site is up to speed. So it's not just something that you do and you're done and you're fully compliant and you move on. It's something that we incorporate into our day-to-day activity.
Thank you, Patty. And one of the things that we really wanted to really do as we are increasing accessibility as well as inclusion is to really get insight from experts who work in this area. As I said earlier, I did do outreach to various journals who really focus on topics of disability and health, but actually that wasn't enough. That wasn't enough. I'm sure people at Health Affairs have heard me say this before, but I've been working in the DEI space for over a decade now. And one topic that I have not been able to touch that falls within various aspects of DEI is actually disability. So with that being known, I said, you know what, this is the time so that we can ensure at Health Affairs that we're being inclusive, to actually form an accessibility and inclusion committee. Next slide, please. The committee serves as a representatives of health services, health policy researchers, community organization leaders, and advocates who are dedicated to improving health and as well as increasing accessibility and opportunities to people living with disabilities. Another one of their goals is to guide Health Affairs with this initiative, with our initiatives, to provide equitable access and opportunities to everyone along the continuum of human ability who engages within the journal, and provide us with the insight about topics related to various aspects of disabilities that can be used as content in the journal and other Health Affairs platform. And as you see, we do have a group of disability and health experts. We looked at this from different angles. They're diverse as it relates to gender, as it relates to race, ethnicity, as well as it relates to, if they're academic researcher or are they doing advocacy work. And some of these include Jillian Copeland, who is the founder of Main Street Connect, an accessibility and inclusive apartment complex and community in Rockville, Maryland. I will say that this issue was interesting because to me there was a lot of social impact, and which for a journal, for a scholarly publishing journal, we sort of like to really go outside of the standards for a journal. And so we did do a community event at the Main Street Connect in Rockville, Maryland, actually for Montgomery County. The evening included a panel discussion about unmet needs in Montgomery County's disability community and ways to address them. And so Jillian, who sits on our committee, was able to provide us with that space. We also have Andreas Galagos, who works with Robin Solomon and Pat, which is a law firm that advocates for people with disabilities. Jean Hall, who's at the University of Kansas, who's also an author in the book, who talks about the intersectionality between disability as well as LGBTQ populations. Monica Mitra at Brandeis University, who talks about disability and health, and also at the intersection of people of color. We also have Maggie Nagrin, who is actually the CEO at the American Association on Intellectual and Developmental Disabilities, who was really an eye-opener because she really did focus on like, hey, when there's another aspect of disabilities that people often leave out, which is intellectual and developmental disabilities, as well as Javier Robles, who was one of our advisors, and John Tashida, who is who leads the Association of the University Centers on Disabilities. Next slide, please. So we did have our inaugural accessibility and inclusion meeting. We did have a strategy section. We did ask the questions: what accessibility improvements must be prioritized prior to the disability and health issue? Patti presented the critical problems that we have with our websites that will serve as a hindrance towards giving everyone accessibility. They talked about that. And then we also talked about how do we reach our targeted communities and how do we plug into disability advocacy. And some interesting things came. I'm just going to share three things that they mentioned. One was, they said that this is great that we're doing this, but they really said, this is repeated a couple of times, do not just make sure that we don't stop with this special issue. And that's the thing that we're doing at Health Affairs. As we advance equity, it may start with an issue, or it may start with a particular aspect of equity, but eventually we want to get to the point where it doesn't take a special issue to include a diverse population of researchers. Also, they wanted to know, they asked us the question, are people aware of Health Affairs? Are we trusted and are we relevant? And I'll talk about that in the next slide. But, and then also, they also mentioned avoid only places people with disability in advisory roles, but at every stage of the process. And that's something that Patti mentioned just a few minutes ago. As we advance equity, the person with disability doesn't have to be the disability expert all the time. And we really want to make sure that we are equitable throughout as we really commission our thought leaders. Next slide, please. Outreach strategy. Next slide. So there was some talk at the meeting about, our outreach strategy, making sure that people in the disability community know who Health Affairs is as a scholarly publishing journal. And so we did do like outreach, which is in Patti's team. We worked together on this, where we did give them names of secondary education programs for students with disabilities. As you see, the Gallaudet University is a part of that. University of Arizona Project Focus on intellectual disabilities, as well as Vanderbilt University Next Steps Intellectual Disabilities. And then we also did some outreach to professional networks that actually have disability initiatives, such as the American Bar Association, the Coalition of Disability Access and Health, the Delta Alpha International Honor Society. We also looked at civil rights organizations such as Access Computing, ADA National Network, as well as the Transgender Law Center Disability Project, as well as other aspects of the disability community, such as the Disability Intersectionality Summit. And on the topic, next slide, please, of intersectionality, we did want to do outreach to those organizations that were at the intersection of disability and health, as well as intersectionality. And so we did do some outreach to specific groups, and a lot of it's interesting. I didn't know that they had these groups for some organizations, such as the HBCU Disability Consortium, the National Black Deaf Advocates, as it relates to Asian American, Pacific Islander, Asian and Pacific Islanders with Disability of California, as it relates to the LGBTQ plus group, as I mentioned, the Transgender Law Center Disability Project. When it comes to Indigenous people, you have the Native American Disability Law Center, as well as the Indigenous Persons with Disabilities Global Network. And when it comes to Chicano, Latinx, and Hispanic, we did have the National Coalition for Latinx with Disabilities. Next slide, please. So we're just going to share with you as we end some lessons learned. There were a lot of lessons learned within this disability and health issue. One of the things that we realized, and this that Patty, I think she will agree with me. There's a recurring thing that language is important. If you are, if your company is getting into the disability space to really make things more equitable for people who identify with having disabilities, please be aware of the various forms of disabilities when communicating. As I mentioned, we have physical disabilities, we have intellectual disabilities, as well as developmental disabilities. And this actually came up early on when we were trying to decide on a name for our accessibility and inclusion committee, in which sort of overlaps within the third bullet that we have. Also, like I said, language is important. Know how to describe persons with disabilities. In this issue, there are two languages to describe people with disabilities. There's the person first language. For example, a person living with a disability, which is the language I usually choose to use the person first language rather than the identity first language, such as a disabled person. As I said, throughout this issue, we did leave it up for the authors who a significant amount were people living with disabilities. They actually could choose either one of those language. But I just wanted you guys to be aware that there are different languages to describe a person living with disabilities. Also, stay away from certain terms or idioms that defines one's ability. One example is using the term wheelchair bound. Which is a term, you know, not to use because it puts limits on a person. An example, I guess, a way that you can use this term, well, not term, but describe this in a better way is that a person using a wheelchair, to gain accessibility along those lines. Idioms such as the blind leading the blind, which is a disrespectful idiom, as well as which we learned the term brain trust. When we first started our accessibility and inclusion committee, we were going to use the term accessibility brain trust. Maggie Nagrin, who's at the American Association of Intellectual and Developmental Disabilities, did let us know that the term brain trust really speaks to someone's intellectual ability. And so because of that, we did change the name to the accessibility and the inclusion committee instead of using the term brain trust. So those are just a couple of things that, a couple of lessons that we have learned. As we advance equity, either if it's in a disability space, race space, gender space, we are forever learning. And so it's very important to be lifelong learners in order to advance equity and be sensitive and appropriate to people. Next slide, please. And this is actually our last slide. And so if you want to find out more about health affairs or read our content, watch our videos, listen to our podcast, please visit us at healthaffairs.org, as well as on Twitter, and LinkedIn. And you can follow Patti and myself on Twitter and LinkedIn. Follow Patti at Patti Kurtz on LinkedIn, and you can follow me on LinkedIn at Vabren Watts. Thank you. And so now we will open the floor for questions. Okay, Patti, did you have anything that you wanted to the lessons learned. I know we learned a lot with
Yeah,
this.
no, I don't think that we covered this one, but I do remember when we had a public request for proposals for people to contribute artwork to the issue. We followed a normal process. We published on our site a 2 to 3 page request for proposals with a brief, with a timeline. And when we did this for the racism and health issue that launched in February 2022, we received well over 15 proposals for some of the work that we were commissioning. For this one, we didn't receive any proposals, really. We received one that was kind of a hybrid with some ideas, but when we spoke to some of our friends within the Accessibility and Inclusion Committee, the feedback was we made it very, very hard and convoluted for someone to submit their artwork. So we were talking to an audience that was ourselves. And so that was a learning for us. We ended up finding the partner through Art Enable. So we ended up doing the outreach, but it tells us that even when we try our hardest, sometimes we still speak like health affairs.
Right. We do have a question, Jessica.
Hey, I'm sorry if you answered this, but I've been curious whether some of the things we've been doing, like ASL interpretation and captions on videos, will those continue for all events going forward, or what's like possible, I guess?
Yeah, well, it's all possible, isn't it? For us, it's dependent on budget in some instances. So we do now transcribe all of our podcasts, which we hadn't done before, and we've made that available on YouTube. It might seem like a strange place to put podcasts, but people do listen to audio only content on YouTube. And we do try to have ASL interpretation at the events where we have the budget available. At a minimum, we always include closed captioning, and we make sure that that's on the videos afterwards. But best practice is to include both. I mean, we've all been at an event where the closed captioning is not correct, so that's really not helpful for someone that's trying to follow along.
And also at every event, there is a statement or question on there to ask the anyone who registers for the event if they need special accommodations. Let's see. Okay, so I think that is it. We thank you for actually attending today's session. Patti and I, as well as thank you for supporting Health Affairs. And we hope that you are able to learn something and that it ignites you to really continue to be advocates of disability and health as well as equity. Thank you.